USMLE Step 1 Sample Test Questions Block 3 Items 93 to 138 93. A 17-year-old boy comes to the emergency department because of severe thirst and weakness and a 4 kg or 8.8 pound weight loss over the past 36 hours. He began having voluminous, painless, watery diarrhea on the airplane while returning from a trip to Thailand 36 hours ago. He has not vomited. While supine, pulse is 110 per minute and blood pressure is 110/60. While standing, pulse is 170 per minute and blood pressure is 70/40. His abdomen is non-tender and bowel sounds are increased. Which of the following treatments is most appropriate at this time? A. Ciprofloxacin. B. Doxycycline. C. Exploratory laparotomy. D. Potassium chloride. E. Rehydration. Or F. Trimethoprim sulfamethoxazole. The answer is E. Rehydration. Profuse superwatery diarrhea means cholera, the so-called rice water stool. That said, regardless of the cause, you treat all causes of volume loss with volume replacement, i.e. normal saline. 94. A 22-year-old man comes to the emergency department because of the recent onset of torticollis and uncontrollable facial grimacing. He began therapy with a new drug 24 hours ago. Which of the following drugs is the most likely cause? A. Amitriptyline. B. Diazepam. C. Fluoxetine. D. Haloperidol. Or E. Levodopa. The answer is D. Haloperidol. Torticollis is a type of focal dystonia, which is a type of EPS or extrapyramidal symptom that's caused by neuroleptics or antipsychotics such as haloperidol. Uncontrollable facial grimacing is a description of tardive dyskinesia, a rarer, sometimes permanent EPS more associated with long-term antipsychotic use. 95. A 66-year-old man has become increasingly short-tempered with his wife. He has diarrhea, weight loss, and weakness in the proximal muscles. He has atrial fibrillation and tachycardia. Which of the following is the most likely diagnosis? A. Congestive heart failure. B. Cushing syndrome. C. Hyperthyroidism. D. Mitral valve prolapse. Or E. Pheochromocytoma. The answer is C. Hyperthyroidism. This question mentions numerous symptoms with only one reasonable single possible cause out of the provided choices, hyperthyroidism. Elevated thyroid hormone can manifest as anxiety, GI hypermotility, tachycardia and AFib, weight loss, heat intolerance, etc. Thyroid disorders are very high yield. Pheochromocytomas, choice E, can cause some of the same symptoms in an episodic fashion, more typically panic attacks, episodic severe hypertension, headache, etc. 96. After being severely beaten and sustaining a gunshot wound to the abdomen, a 42-year-old woman undergoes resection of a perforated small bowel. During the operation, plastic reconstruction of facial fractures and open reduction and internal fixation of the left femur are also done. 36 hours post-operatively, she is awake but not completely alert. She is receiving intravenous morphine via a patient-controlled pump. She says that she needs the morphine to treat her pain, but she is worried that she is becoming addicted. She has no history of substance use disorder. She drinks 1 to 2 glasses of wine weekly. Which of the following initial actions by the physician is most appropriate? A. Reassure the patient that her chance of becoming addicted to narcotics is minuscule. B. Maintain the morphine but periodically administer intravenous naloxone. C. Switch the patient to oral acetaminophen as soon as she can take medication orally. D. Switch the patient to intramuscular lorazepam. Or E. Switch the patient to intravenous phenobarbital. The answer is A. Reassure the patient that her chance of becoming addicted to narcotics is minuscule. Narcotic use for acutely painful conditions is both reasonable and important. Short-term use, immediately post-surgical, does not lead to long-term dependence. Don't forget that even drug addicts should also receive narcotics to control pain initially. 97. A 49-year-old woman is found to have mild proteinuria and pyuria on routine screening. Urine-specific gravity is 1.0. Culture of the urine grows no organisms. She has taken large doses of combination over-the-counter analgesic preparations for 10 years due to a low back injury. Which of the following renal abnormalities is most likely in this patient? A. Acquired cystic disease. B. Acute glomerulonephritis. C. Hyperplastic arteriolitis. D. Nephrolithiasis. E. Papillary necrosis. The answer is E. Papillary necrosis. The most important cause of papillary necrosis is analgesia-abuse nephropathy, a type of kidney damage caused by long-term use of OTC pain medications. Ischemia from disruption of blood flow from the vasa recta causes necrosis and sloughing of the renal papilla. Hematuria and sterile pyuria are common. 98. A previously healthy 26-year-old patient developed shortness of breath over several hours during a mountain climb at 5,000 meters or 16,404 feet. There is no history of trauma. On examination, the point of cardiac apical impulse is not displaced and there are widespread crackles throughout both lung fields. Which of the following X-rays of the chest shown best represents this patient? The answer here is A. Chest X-ray image A. Altitude sickness can cause high-altitude pulmonary edema, which is a type of ARDS. The X-ray demonstrates diffuse bilateral fluffy infiltrates. Acute respiratory distress syndrome, or ARDS, is defined by the acute onset of bilateral pulmonary infiltrates and severe hypoxemia in the absence of evidence of cardiogenic pulmonary edema. 99. During an experiment, an investigator finds a point mutation from CGG to TGG in the gene encoding the protein kinase regulatory subunit. The genetic code is shown in the figure above. This mutation is most likely to alter the amino acid sequence with which of the following changes? A. ARG to TRP. B. GLY to ARG. C. GLY to TRP. D. THR to GLY. Or E. TRP to ARG. The answer is A. ARG to TRP, or arginine to tryptophan. This is a simple genetics question that requires you to interpret a genetic code chart and to remember that T in DNA is replaced by U in RNA. 100. A 6-day-old breastfed boy is brought to the emergency department by his mother because of poor weight gain and irritability since delivery, and a 2-hour history of vomiting. Physical examination shows jaundice and hepatomegaly. A reducing substance test result of the urine is positive, and a glucose oxidase test result is negative. The concentration of which of the following metabolites in liver is most likely increased in this patient? A. Fructose 1,6-bisphosphate. B. Galactose 1-phosphate. C. Glucose 1-phosphate. Or D. Glucose 6-phosphate. The answer is B. Galactose 1-phosphate. What we have here is a congenital intolerance to breast milk, galactosemia. In this process, the body cannot convert galactose to glucose, resulting in an accumulation of galactose-1-phosphate. Hypergalactosemia is associated with 3 enzyme deficiencies. GALT deficiency, or galactose-1-phosphate uridyl transferase deficiency, is responsible for hereditary galactosemia and is the most common deficiency of the 3. This enzyme catalyzes conversion of galactose-1-phosphate and UDP glucose to UDP galactose and glucose-1-phosphate. 101. A 35-year-old man comes to the physician because of pain and swelling of his right arm where he scraped it on a tree branch 2 days ago. His temperature is 38.3 degrees Celsius or 101 degrees Fahrenheit. Examination of the right forearm shows edema around a fluctuant erythematous lesion at the site of trauma. The area is extremely tender to palpation. Which of the following is most likely the primary mechanism of the development of edema in this patient? A. Degranulation of eosinophils. B. Disruption of vascular basement membranes. C. Increased hydrostatic pressure. D. Release of thromboxane. Or E. Separation of endothelial junctions. The answer is E. Separation of endothelial junctions. Endothelial tight junction permeability is increased in response to injury and inflammation, allowing migration of white blood cells to the site of injury. 102. A 72-year-old man collapses while playing golf. He has a 5-year history of angina and type 2 diabetes mellitus. Paramedics arrive in 10 minutes. Examination shows no respirations or blood pressure. An EKG shows asystole. Cardiopulmonary resuscitation is attempted for 10 minutes without success. Which of the following is the most likely cause of death in this patient? A. Cardiac tamponade. B. Embolus to the right middle cerebral artery. C. Necrosis of the myocardium. D. Rupture of the papillary muscle. Or E. Ventricular fibrillation. The answer is E. Ventricular fibrillation. VFib is the most common cause of sudden cardiac death immediately after myocardial infarction. This is why we have AEDs located in every building. Papillary muscle rupture occurs classically 2 to 7 days after an MI and results in massive life-threatening mitral regurg. Free ventricular wall rupture after an MI can result in cardiac tamponade. 103. A 60-year-old woman with reflux esophagitis comes to the physician for a follow-up examination. She has been undergoing proton pump inhibitor therapy for the past month and shows clinical improvement. Upper endoscopy is done. A biopsy specimen of the stomach is most likely to show which of the following? A. Acute inflammation. B. Gastric atrophy. C. Intramucosal smooth muscle. D. Lymphoid nodules. Or E. Parietal cell hyperplasia. The answer is E. Parietal cell hyperplasia. PPIs raise pH by preventing the normal secretion of hydrochloric acid into the stomach by parietal cells. The body attempts to counteract this unnaturally basic gastric pH with compensatory hypertrophy. If our medications are moving a measured element beyond its set point, the body nearly always tries to compensate. 104. A 40-year-old woman receives an intravenous infusion of drug X that selectively constricts the efferent arterioles in her kidneys. Following the infusion, total cardiac output and renal afferent arteriolar tone are unchanged, but renal efferent arteriolar tone and total renal vascular resistance have both increased. Which of the following sets of changes most likely occurred following the infusion of drug X? A. Decreased GFR, decreased filtration fraction, and increased renal blood flow. B. Decreased GFR, increased filtration fraction, and decreased renal blood flow. C. Decreased GFR, increased filtration fraction and neutral renal blood flow. D. Increased GFR, decreased filtration fraction, and neutral renal blood flow. Or E. Increased GFR, increased filtration fraction, and decreased renal blood flow. The answer is E. Increased GFR, increased filtration fraction, and decreased renal blood flow. The afferent/efferent arteriole concept is worth knowing. When the efferent arteriole is independently constricted, the blood can get into the glomerulus but has difficulty getting out. Thus, more blood spends a greater amount of time inside the glomerulus being filtered. Therefore, GFR goes up, filtration fraction goes up, but overall blood flow is decreased due to the increased resistance of the system as a whole. 105. A 28-year-old woman comes to the physician because of a 6-month history of intermittent feelings of progressive, overwhelming fear and apprehension, restlessness, and palpitations. She says that she often feels tense and she has difficulty concentrating because she is unable to stop thinking about the things that worry her. Physical examination shows no abnormalities. A selective serotonin reuptake inhibitor, SSRI, is prescribed for long-term management. Which of the following is most appropriate to provide immediate relief for this patient until the effects of the SSRI treatment occur? A. Alprazolam. B. Amitriptyline. C. Diphenhydramine. D. Haloperidol. E. Phenobarbital. Or F. Tramadol. The answer is A. Alprazolam. Benzodiazepines, including alprazolam aka Xanax, are effective at treating anxiety conditions. Ideally, their use should be limited to bridge therapy awaiting the efficacy of safer, less habit-forming maintenance medications like SSRI and buspirone. 106. A healthy 28-year-old woman comes to the physician for advice on losing weight. She is 150 centimeters or 4 feet 11 inches tall and weighs 56 kgs or 124 pounds. BMI is 25. Physical examination shows no other abnormalities. The physician recommends a diet that will restrict her daily intake by 500 kilocalories. Which of the following processes is most likely to increase in this patient as a result of following this diet? A. Adipocyte glucose uptake. B. Cerebral ketone utilization. C. Hepatic lipid oxidation. D. Muscle glucose uptake. Or E. Resting energy expenditure. The answer is C. Hepatic lipid oxidation. If you don't eat enough calories to run your metabolism, your body will mobilize its stores. We burn fat through fatty acid oxidation to provide fuel/energy for gluconeogenesis. Adipocyte and muscle glucose uptake are related to insulin effects, and cerebral ketone utilization would occur in starvation after several days. Resting energy expenditure would correlate to available fuels, thus it should not increase in this scenario. 107. A 25-year-old woman has a routine pre-employment physical examination. Laboratory studies include hemoglobin 11.3, hematocrit 34%, erythrocyte count 5.2 million, and mean corpuscular volume 65. Follow-up laboratory studies show that the serum iron concentration and iron binding capacity are within the reference ranges. Hemoglobin electrophoresis shows increased hemoglobin A2 at 5%. Which of the following is the most likely diagnosis? A. Anemia of chronic disease. B. Iron deficiency anemia. C. Sideroblastic anemia. D. Alpha thalassemia minor. Or E. Beta thalassemia minor. The answer is E. Beta thalassemia minor. Chronic microcytic anemia in a patient with normal iron studies should make you think of thalassemia. Beta thalassemia minor is the most common and is typically quite mild. As there is decreased beta chain production, there is a relative excess of alpha chains. 108. An 18-year-old woman comes to the physician for a health maintenance examination. She has not had major medical illnesses. She takes no medications. She does not smoke cigarettes, drink alcohol, or use illicit drugs. Physical examination shows diffuse brownish-yellow discoloration of all teeth. Which of the following most likely occurred during childhood to cause this finding? A. Amylogenesis imperfecta. B. Dentinogenesis imperfecta. C. Rh incompatibility. D. Syphilis. E. Tetracycline use. Or F. Vitamin D deficiency. The answer is E. Tetracycline use. Tetracycline use during childhood is commonly associated with tooth discoloration, typically yellow-brown and sometimes described as gray. 109. A 16-year-old boy comes to the physician because of a rash on his left inner thigh that first appeared 2 days after he returned from a hunting trip with friends in Minnesota. A photograph of the rash is shown. Without treatment, this patient is at increased risk for which of the following? A. Carditis. B. Glomerulonephritis. C. Hepatitis. D. Pancreatitis. Or E. Thrombocytopenia. The answer is A. Carditis. A target-shaped rash after a woodland excursion means Lyme disease caused by Borrelia burgdorferi, which is carried by the Ixodes tick. Rash, known as erythema migrans, viral syndrome symptoms, fatigue, and polyarthritis are common. Lyme carditis typically manifests as AV block. 110. A 37-year-old woman comes to the physician because of a 2-month history of pain with movement of her hands and feet. Physical examination shows warmth and swelling of the metacarpophalangeal and metatarsophalangeal joints. Laboratory studies show increased titers of antibodies to Fc component of IgG and a negative anti-nuclear antibody test result. A drug is prescribed that binds to tumor necrosis factor alpha and blocks its interaction with cell surface TNF receptors. Her symptoms improve within 1 month. She is most likely receiving treatment with which of the following drugs? A. Adalimumab. B. Anakinra. C. Gold. D. Methotrexate. Or E. Prednisone. The answer is A. Adalimumab. The question says that the patient is prescribed a TNF-alpha inhibitor. Adalimumab is the only TNF inhibitor on the list. Targeted therapies are usually monoclonal antibodies and thus end in AB. 111. A 63-year-old homeless man is brought to the emergency department 1 hour after police found him unresponsive. His respirations are 30 per minute. Crackles are heard over the left upper and the entire right lung fields. Despite appropriate life-saving measures, he dies. A photomicrograph of a section of the right lung obtained at autopsy is shown. Which of the following mediators is the most likely cause of the position of the cell indicated by the arrow? A. Bradykinin. B. C5a. C. Histamine. D. Nitrous oxide. Or E. Prostaglandins. The answer is B. C5a. The arrow is pointing to a neutrophil with its multilobed nucleus. These are the main fighters of the immune system in acute inflammation and bacterial infection, such as aspiration pneumonia. C5a is a chemotactic factor for PMNs. 112. A 48-year-old man with AIDS has chorioretinitis with flame-shaped hemorrhages and large white patches. 3 weeks after starting therapy, his vision is improved, but he has granulocytopenia. Which of the following antiviral agents is most likely responsible for these findings? A. Amantadine. B. Foscarnet. C. Ganciclovir. D. Lamivudine. Or E. Ribavirin. The answer is C. Ganciclovir. AIDS retinitis is caused by CMV, which is typically seen with CD4 counts less than 50. Treatment is with ganciclovir. Neutropenia and thrombocytopenia are also known adverse effects of ganciclovir. 113. A 30-year-old woman, gravida 3, para 3, comes to the physician because of a 2-month history of loss of urine when she sneezes or laughs. Her 3 children were all delivered vaginally at term. Physical examination shows no abnormalities. Which of the following nerve roots supplies the muscle group that is weakened in this patient? A. C1 to 2. B. L1 to 2. C. L4 to 5. D. S1 to 2. Or E. S3 to 4. The answer is E. S3 to S4. This patient has stress incontinence, a common complaint in women after vaginal childbirth. The risk of stress incontinence increases with the number of deliveries, the size of the baby, and use of forceps, etc. The pelvic floor muscles and urogenital diaphragm are innervated primarily by the S3 to S4 nerve roots. 114. A 36-year-old woman has been trying to conceive for the past 2 years. Her menses occur every 19 to 45 days. She has a past history of some type of sexually transmitted disease, but says she was treated and cured. She is 163 centimeters or 5 foot 4 inches tall and weighs 109 kgs or 240 pounds. BMI is 41. Physical examination, including a pelvic examination, is unremarkable. An endometrial biopsy is performed based on the menstrual history and a negative pregnancy test. The biopsy shows stromal breakdown associated with proliferative glands. Which of the following is the most likely cause of her infertility? A. Anovulation. B. Chronic endometritis. C. Endometrial polyps. D. Endometriosis. Or E. Leiomyomata. The answer is A. Anovulation. Chronic anovulation is a common cause of infertility. Long periods are often anovulatory, where lack of an LH surge leads to unchecked estrogen and prevents ovulation and the secretory and menstrual phases that follow, leading to chronic proliferative phase endometrium and irregular menses. These can be long or short and are often light, as only the endometrial tissue that outgrows its blood supply sloughs off. 115. A 1-day-old newborn is evaluated for possible sepsis. Blood cultures grow gram-positive cocci in pairs and chains that agglutinate with group B antiserum. The most likely epidemiologic risk factor for this infection involves bacterial colonization of which of the following? A. Mother's vagina. B. Newborn's gastrointestinal tract. C. Newborn's nasopharynx. D. Placenta. Or E. Umbilical cord remnant. The answer is A. Mother's vagina. GBS comes from a mother's colonized vagina and is the most common cause of neonatal sepsis. Women who are GBS positive should receive penicillin prophylaxis prior to delivery to prevent exposure to the fetus during delivery. Vaginal rectal screening for GBS colonization is done at 35 to 37 weeks. 116. A 26-year-old woman is brought to the emergency department by her mother 1 hour after she had a generalized tonic-clonic seizure at home. The mother states that her daughter has been talking to herself at all hours of the day and night about being thirsty. The patient was found to have schizophrenia 6 years ago. Her only medication is haloperidol. She was admitted to the hospital twice in the past year for psychotic episodes. Physical examination shows no other abnormalities. She is oriented to person but not to place or time. Her serum sodium concentration is 114 on arrival but returns to normal with appropriate treatment. Which of the following interventions is the most appropriate next step? A. Refer the patient for behavior therapy. B. Restrict the patient's fluid intake. C. Add lithium carbonate to the medication regimen. D. Administer furosemide therapy. Or E. Begin mineralocorticoid therapy. The answer is B. Restrict the patient's fluid intake. Psychogenic polydipsia is associated with several psychiatric conditions, particularly schizophrenia. It is also sometimes felt to be secondary to the dry/cotton mouth seen with certain medications, including antipsychotics. Patients present with hyponatremia due to their excessive free water intake. In some cases, a water deprivation test is necessary to distinguish psychogenic polydipsia from diabetes insipidus. 117. A 29-year-old man is brought to the physician for removal of a cast from his left leg. He sustained a fracture of the left lower extremity 6 weeks ago and was immobilized in a cast that extended just below the knee to the foot. At the time of injury, there was severe pain but normal strength in the extremity. When the cast is removed today, physical examination shows a pronounced left foot drop with paresthesia and sensory loss over the dorsum of the left foot and lateral leg. Injury to which of the following nerves is the most likely cause of this patient's condition? A. Common fibular or peroneal. B. Femoral. C. Obturator. D. Sciatic. Or E. Tibial. The answer is A. Common fibular or peroneal. Foot drop after compression in the lower leg equals common fibular/peroneal nerve. Nerve compression syndrome is one reason why it's important the cast not be too tight. 118. An investigator is studying the effect of the number of hours watching television, factor A, on the percent of hemoglobin A1C in people with type 2 diabetes mellitus. Two different variables, factor A and hemoglobin A1C, are compared. The results of the study indicate a correlation coefficient of positive 0.9. Which of the following graphs shown best corresponds to these results? The answer here is graph A. The closer R is to 1, the more closely the data points should fit to a line. The correlation coefficient in the question is positive 0.9. Graph A is the only one that shows a linear correlation with a positive slope. Graph B appears scattered, Graph C is a negative stepwise correlation, and Graph D looks closer to a horizontal line. 119. A 24-year-old woman comes to the physician for a follow-up examination. 1 week ago, she was treated in the emergency department after she accidentally spilled hot grease on her left leg while working at a fast food restaurant. Examination of the left lower extremity shows a 7 cm pink, soft, granular, edematous wound. The formation of this tissue was most likely caused by increased activity of which of the following? A. Complement C3b. B. Glycosylation-dependent cell adhesion molecule 1. C. P-selectin. D. Stromalysin. Or E. Vascular endothelial growth factor. The answer is E. Vascular endothelial growth factor, or VEGF. VEGF is a major tissue growth factor activated by injury, cytokine release, infection, inflammation, and hypoxia that promotes angiogenesis and also increases vascular permeability, hence the edema. This increased permeability aids in the movement of proteins and white blood cells to the site of injury. 120. A 10-year-old boy is brought to a new physician by his parents for an initial examination. The patient was born with congenital glaucoma, hearing loss, and a patent ductus arteriosus that has since been surgically corrected. At the time of birth, he also had purpura, jaundice, and splenomegaly. He is in a special education class for students with mental retardation. He is at the 75th percentile for height and weight, and 5th percentile for head circumference. This patient's condition was most likely caused by in utero exposure to which of the following? A. Cytomegalovirus infection. B. HIV infection. C. Rubella. D. Syphilis. Or E. Toxoplasmosis. The answer is C. Rubella. In this question, they have described the components of congenital rubella. The distributed purpura and splenomegaly are a result of extramedullary hematopoiesis, and this is a description of the classic blueberry muffin rash, which you are highly unlikely to hear actually described as on the test. Congenital glaucoma, hearing loss, and a patent ductus arteriosus are also associated with congenital rubella. 121. A 45-year-old woman is brought to the physician because of a 4-month history of muscle fatigue. She says that she has difficulty initiating movements and focusing her eyes. Physical examination shows bilateral ptosis of the upper eyelids. Repetitive nerve stimulation testing of a motor nerve shows a 30% decrease in the compound muscle action potential amplitude. A CT scan of the chest is shown. The arrow indicates an abnormality. Which of the following is the most likely cause of the muscle weakness in this patient? A. Mesothelioma of the pleura. B. Myasthenia gravis. C. Sarcoidosis. D. Small cell carcinoma of the lung. Or E. Squamous cell carcinoma of the esophagus. The answer is B. Myasthenia gravis. Fatigable weakness, particularly of the eyes, is classic myasthenia gravis, an autoimmune condition caused by antibodies that block acetylcholine receptors at the postsynaptic neuromuscular junction. The arrow is pointing to the patient's prominent thymus as shown in the CT scan image. Thymoma and thymic hyperplasia are common in patients with myasthenia gravis, and thymectomy is curative in a portion of patients. Small cell carcinoma of the lung is associated with Lambert-Eaton myasthenic syndrome, which is a disease caused by autoantibodies against presynaptic calcium channels. These patients classically begin weak and experience a warm-up effect after some use. They ultimately become weak again, however. 122. An investigator is conducting a study of hypertension in an experimental animal model. Results show that hypertension is induced when one renal artery is constricted with a clamp, but both kidneys remain intact. Which of the following best explains the contribution of the normal kidney to the hypertension in this experimental model? A. Aldosterone-induced sodium and water retention. B. Angiotensin I-induced vasoconstriction. C. Angiotensin II-induced renal vein constriction. D. Expression of angiotensin-converting enzyme. Or E. Increased renin secretion. The answer is A. Aldosterone-induced sodium and water retention. Renal artery stenosis causes decreased blood flow to the supplied kidney, which results in the activation of the renin-angiotensin-aldosterone system, because the hypoperfused kidney secretes renin from the juxtaglomerular cells. The normal kidney has normal renin secretion. However, the additional circulating aldosterone will cause the normal kidney to also retain sodium and water. 123. 123. One day after a 10-kilometer race, a previously healthy 42-year-old man has dark urine. Urinalysis shows specific gravity 1.010, urine dipstick shows glucose negative, blood positive, nitrites negative. Microscopic examination shows white blood cells negative, red blood cells negative. Which of the following is the most likely cause of these findings? A. Acute glomerulonephritis. B. Hypovolemia. C. Renal infarct. D. Renal vein thrombosis. Or E. Rhabdomyolysis. The answer is E. Rhabdomyolysis. Tons of exercise followed by renal failure is always going to be rhabdomyolysis on an exam. Dark urine without actual blood in it, i.e. no RBCs, is due to myoglobinuria, which can cause a false positive urine dipstick. 124. A 68-year-old man comes to the physician because of worsening, non-productive cough and progressive shortness of breath during the past 2 months. 3 months ago, he was able to walk an unlimited distance without difficulty. Now, he becomes short of breath after walking 1 block. He has had no fever, chest pain, or leg swelling. He has atrial fibrillation and hypertension treated with medications. His temperature is 37.7 degrees Celsius or 99.8 degrees Fahrenheit. Pulse is 90 per minute, and respirations are 22 per minute. Pulse oximetry on room air shows an oxygen saturation of 92%. Diffuse inspiratory crackles are heard bilaterally. The remainder of the examination shows no abnormalities. His plasma brain natriuretic peptide concentration is within the reference range. A chest X-ray shows bilateral interstitial infiltrates. Which of the following medications is the most likely cause of these findings? A. Amiodarone. B. Digoxin. C. Lisinopril. D. Metoprolol. Or E. Procainamide. The answer is A. Amiodarone. In addition to thyroid problems, amiodarone can cause interstitial lung disease, including potentially fatal, non-reversible pulmonary fibrosis. Digoxin is infamous for its narrow therapeutic range and numerous side effects, including green-yellow vision changes. Lisinopril can cause angioedema as well as hyperkalemia. Metoprolol can exacerbate asthma in addition to causing dizziness, bradycardia, and hypotension. Procainamide can cause drug-induced lupus. 125. A 2-week-old female newborn delivered at term is brought to the physician by her mother because of an increasingly severe diaper rash since birth. No congenital anomalies were noted after delivery. Physical examination shows a red and swollen umbilical remnant that has not separated. There are ulcerations of the skin, but no purulent exudate in the area of the diaper. A culture of one of the ulcers grows Staphylococcus aureus. Despite antibiotic therapy, 1 month later she develops a perirectal fissure, culture of which grows E. coli, but a smear of which shows scarce segmented neutrophils. Laboratory studies now show hemoglobin 12.7, hematocrit 38, mean corpuscular volume 98, leukocyte count 89,790, segmented neutrophils 89%, bands 6%, lymphocytes 3%, monocytes 2%, platelet count 249,000, serum IgA 92, serum IgG 766, serum IgM 101. A peripheral blood smear shows normochromic normocytic erythrocytes and leukocytes with normal morphology. The patient most likely has which of the following conditions? A. Acute myelogenous leukemia. B. AIDS. C. Shediac-Higashi syndrome. D. Common variable immunodeficiency. Or E. Leukocyte adhesion deficiency. The answer is E. leukocyte adhesion deficiency. Delayed separation of the umbilical stump is a classic clue for leukocyte adhesion deficiency. ICAM is the defective ligand most often asked about as a second-order question. 126. A 52-year-old woman comes to the physician because of a 1-month history of headache, weakness, tingling of her extremities, muscle cramping, and fatigue. Her blood pressure is 170/110. Physical examination shows no other abnormalities. Laboratory studies show a decreased serum potassium concentration, metabolic alkalosis, and decreased plasma renin activity. Serum sodium concentration is within the reference range. Urine catecholamine concentrations are within the reference range. Which of the following is the most likely diagnosis? A. Adrenal adenoma. B. Focal segmental glomerulosclerosis. C. Hypothalamic tumor. D. Juxtaglomerular cell tumor. Or E. Renal artery stenosis. The answer is A. Adrenal adenoma. This patient has Conn syndrome, or primary hyperaldosteronism, most commonly caused by a hyperfunctioning adrenal adenoma. This is an important and highly tested cause of refractory hypertension. The patient has lab abnormalities consistent with high aldosterone, i.e. high sodium, low potassium, and metabolic alkalosis with an appropriately suppressed renin. 127. A 72-year-old man who is a retired construction worker comes to the physician because he has had a lesion on his face for 3 months. Physical examination shows a 6 mm red, ulcerated lesion with heaped borders. A biopsy specimen of the lesion shows atypical dysplastic keratinocytes within the epidermis and dermis. Which of the following is the most likely diagnosis? A. Actinic keratosis. B. Discoid lupus erythematosus. C. Melanoma. D. Mycosis fungoides. Or E. Squamous cell carcinoma. The answer is E. Squamous cell carcinoma. A chronic, heaped-up ulcerative lesion of the skin, especially on sun-exposed areas in people who spend time outdoors, means cancer. If it's keratinocytes at play and not melanocytes, that leaves you with either squamous cell or basal cell carcinoma. 128. An 84-year-old woman who resides in an assisted living facility is brought to the emergency department because of fever and cough for 1 week. The cough has been productive of foul-smelling yellow-green sputum for 24 hours. She has a 2-year history of dementia, Alzheimer type. Her temperature is 38.5 degrees Celsius or 101.3 degrees Fahrenheit. Pulse is 80 per minute, respirations are 20 per minute, and blood pressure is 116/66. Coarse inspiratory crackles are heard over the right lung field. Laboratory studies show a leukocyte count of 13,500, 72% segmented neutrophils, 8% bands, 1% eosinophils, 16% lymphocytes, and 3% monocytes. A CT scan shows a cavitary lesion in the superior segment of the right lower lobe. The lesion has a thick wall and an irregular peripheral margin. There is no displacement of the adjacent bronchovascular bundle. Which of the following is the most likely cause of the lung lesion in this patient? A. Antecedent viral pneumonia. B. Aspiration of gastric contents. C. Bronchial obstruction by metastatic carcinoma. D. Lung infarction secondary to arterial thrombosis. E. Primary carcinoma of the lung. F. Secondary infection of a congenital lung cyst. Or G. Septic embolism from an extrapulmonary site. The answer is B. Aspiration of gastric contents. Alcoholics and any person with an altered level of consciousness are a setup for aspiration pneumonia, classically a right lower lobe pneumonia that is foul-smelling. The associated organism that appears most on exams will be Klebsiella. 129. A 20-year-old man comes to the physician's office for a scheduled health maintenance examination. His father died of a myocardial infarction at age 55 years. Physical examination shows a tendon xanthoma on the elbow. His serum total cholesterol concentration is 360 mg per deciliter. A mutation is most likely to be found in which of the following genes? A. ApoA2, B. ApoC2, C. ApoE epsilon 4, D. LDL receptor, or E. VLDL receptor. The answer is D. LDL receptor. Cholesterol xanthomas, horrible serum cholesterol levels, and early death by MI are all signs of familial hypercholesteremia caused by a defect in the LDL receptor. 130. A full-term, 2-week-old male newborn has cyanosis. Pregnancy and delivery were uncomplicated. His lungs are clear, and a mid-systolic murmur is heard that is loudest in the left third intercostal space and associated with a thrill. Which of the following is the most likely diagnosis? A. Atrial septal defect, B. Bicuspid aortic valve, C. Coarctation of the aorta, D. Patent ductus arteriosus, or E. Tetralogy of Fallot. The answer is E. Tetralogy of Fallot. All of the congenital heart defects and their associated murmurs are high yield and worth memorizing. Understanding murmur physiology is also high yield in general. In this case, we have a cyanotic heart condition in a newborn. Tetralogy of Fallot is the most common cyanotic heart lesion on tests and in real life. ASDs, which have a fixed slit S2, are left to right, i.e. non-cyanotic lesions, at least until they reverse down the line, resulting in Eisenmenger syndrome. Clinically significant PDAs are alluded to by their continuous machinery murmur. 131. A study is conducted to assess the relationship between serum protein YY, PYY, concentrations, and obesity. A total of 24 subjects with BMIs ranging from 17 to 40 kilograms per meter squared are enrolled in the study. A fasting serum PYY concentration is determined for each patient. The investigators report that the correlation coefficient between the two parameters is negative 0.84 with the p-value less than 0.001. Based on these results, which of the following is the most accurate conclusion? A. A decreased serum PYY concentration is a cause of obesity. B. The likelihood of a correlation between high BMIs and serum PYY concentrations is 0.16. C. Obesity is not related to serum PYY concentrations. D. The slope of the line showing the relationship between serum PYY concentrations and BMIs is negative 0.84. Or E. Subjects with lower BMIs have higher serum PYY concentrations. The answer is E. Subjects with lower BMIs have higher serum PYY concentrations. The question states that the correlation coefficient between serum PYY concentration and BMI is negative 0.84. A negative R value means that the relationship between the variables is inverse, i.e. not direct, so as one goes up, the other goes down. It is important to remember that correlation does not equal causation. 132. A 47-year-old woman comes to the emergency department because of a 2-week history of intermittent abdominal pain, nausea, and vomiting. She has had similar episodes sporadically during the past 4 years. Physical examination shows dehydration, jaundice, and upper abdominal distension. Laboratory studies show hyperbilirubinemia. A CT scan and upper GI series of the abdomen with oral contrast are shown. The arrows indicate the abnormality. Which of the following is the most likely cause of these findings? A. Annular pancreas. B. Cirrhosis of the liver. D. Duodenal constriction by the portal vein. D. Duodenal constriction by the superior mesenteric artery. Or E. Pyloric stenosis. The answer is A. Annular pancreas. An annular pancreas occurs when the pancreas is wrapped around the second or descending portion of the duodenum. When symptomatic, in adults typically when there is superimposed pancreatitis, it can block flow of GI contents through the intestines. The CT scan image shows constriction of the intestines by the pancreas, although the question stem alone provides enough clues to select the correct answer. 133. A 37-year-old woman with right lower extremity edema is evaluated because of the sudden onset of shortness of breath and pleuritic chest pain. A diagnosis of pulmonary embolism is made. Which of the following signs, if present on physical examination, would be the most specific indicator of pulmonary arterial hypertension in this patient? A. Increased jugular venous pressure. B. P2 louder than A2. C. Peripheral edema. D. Presence of an S3. Or E. Pulmonary crackles. The answer is B. P2 louder than A2. The heart's left-sided system is much higher pressure than the right side, hence the aortic valve closing is usually louder than the pulmonic valve. A P2 louder than A2 means that the pulmonary artery pressure is significantly elevated, i.e. pulmonary arterial hypertension. 134. A 56-year-old man comes to the emergency department because of a 4-day history of colicky right flank pain that radiates to the groin and hematuria. Ultrasound examination of the kidneys shows right-sided hydronephrosis and a dilated ureter. Which of the following is most likely to be found on urinalysis? A. Erythrocyte casts. B. Glucose. C. Leukocyte casts. D. Oval fat bodies. Or E. Uric acid crystals. The answer is E. Uric acid crystals. Colicky flank pain that radiates to the groin and hematuria is classic of a kidney stone, even without the clues on ultrasound. Calcium oxalate stones are the most common variety of kidney stones, but uric acid stones make up 5 to 10% as well. None of the other choices are associated with renal calculi of any variety. 135. A 62-year-old man comes to the physician for a follow-up examination after he was diagnosed with chronic inflammatory interstitial pneumonitis. Following pulmonary function testing, a biopsy specimen of the affected area of the lungs is obtained. Compared with a healthy man, analysis of this patient's biopsy specimen is most likely to show which of the following patterns of changes in the cell populations of alveoli, i.e., which direction do the type 1 pneumocytes, type 2 pneumocytes, and fibroblasts move in terms of quantity? The answer here is E. There would be a decrease in type 1 pneumocytes, an increase in type 2 pneumocytes, and an increase in fibroblasts. The patient's chronic inflammatory pneumonitis is killing off his lung parenchyma, composed primarily of type 1 pneumocytes. Type 2 pneumocytes, in addition to making surfactant, can replicate in order to replace type 1 pneumocytes, so they will be increased. Chronic interstitial inflammation results in fibrosis, hence there would also be an increase in fibroblasts. 136. A 63-year-old man with a 5-year history of congestive heart failure comes to the emergency department because of a 1-month history of fatigue and labored breathing. Evaluation shows pulmonary edema. Furosemide is administered. Which of the following sets of physiologic changes is most likely following administration of the drug? i.e., how does the sodium-potassium chloride transport in the thick ascending loop of Henle change? How does the osmolarity of the medullary interstitium change? And how does the water absorption in the descending loop of Henle change? The answer here is H. There would be a decrease in the sodium-potassium chloride transport in the thick ascending loop of Henle. There would be a decrease in the osmolarity of the medullary interstitium, and there would be a decrease in water absorption in the descending loop of Henle. Furosemide is a prototypical loop diuretic, which works by blocking the triporter, sodium-potassium chloride, and preventing the reabsorption of 1 potassium ion, 1 sodium ion, and 2 chloride ions. So less potassium-sodium chloride ion transport causes decreased osmolarity of the medullary interstitium where these ions would normally enter. Water follows solute, so with less ions reabsorbed, the medullary gradient will be less, and less water will be reabsorbed. 137. A 55-year-old man with a history of drug and alcohol abuse undergoes operative placement of a portosystemic shunt to relieve portal hypertension. During this procedure, it is most appropriate for the physician to anastomose a major tributary of the portal vein to which of the following vessels? A. Left gastric vein. B. Left renal vein. C. Splenic vein. D. Superior mesenteric vein. Or E. Umbilical vein. The answer is B. Left renal vein. Surgical portosystemic shunts are most often performed by anastomosing the splenic vein to the nearby left renal vein. The splenic vein and SMV join to form the main portal vein. More commonly, a TIPS procedure is performed to create an intrahepatic shunt between the portal and hepatic veins. 138. A 52-year-old woman is admitted to the hospital because of breast cancer metastatic to the liver. Her prognosis is poor. She begs her husband to stay with her at the hospital because she is afraid to be left alone. Which of the following defense mechanisms best explains her behavior? A. Denial. B. Displacement. C. Regression. D. Repression. Or E. Sublimation. The answer is C. Regression. If an adult is taking on behaviors that would be more common in children, in this case, the patient begging her husband to stay with her because she is afraid to be left alone, it is called regression. Thank you very much for listening. Please leave comments and suggestions. Good luck.